Excellent, thank you. Thanks for the introduction. My name is Danielle Muscat. I'm from the University of Sydney, Sydney Health Literacy Lab and Wiser Healthcare teams. So everybody in the room has seen the resource displayed on the screen, the Choosing Wisely Australia 5 questions for consumers to ask healthcare providers before any test, treatment or procedure. We know that in 2015 and 16, about 8% of healthcare consumers were aware of the resource, and that by 2017, it was the most commonly downloaded resource from the website. However, as researchers, we're really interested in knowing more about the potential impact of resources on consumers' self-efficacy to ask questions and participate in shared decision-making, and on their intention to participate in shared decision-making as well. So what impact can these resources have? And given that previous research has shown that adults with lower health literacy are less likely to ask questions and less likely to be involved in decisions about their health, we also wanted to look at and determine whether health literacy plays a role in determining the effects of interventions such as these. So how did we do this? So we wanted to compare the 5 questions resource with other evidence-based intervention formats to see what's most helpful. So in addition to the 5 questions, we developed a 3-minute video to prepare patients to participate in shared decision-making before the much more impressive conversation starter kit and video had been developed. So basically, guided by the literature, our video explained to patients what to expect from a healthcare encounter. It reassured patients that there are 2 experts, both healthcare provider and patients, so that they have something valuable to contribute in healthcare consultations. They challenged attitudes that there are necessarily right and wrong decisions in some healthcare encounters. They promoted the social acceptability of active participation in healthcare decision-making, and it supported patients to believe that they can take part in conversations about their health. So here's a sneak peek, or not. There we go. And can help you make decisions that you are happy with.
There are benefits and harms, or pros and cons, to every treatment. Asking questions and sharing decisions with your doctor can be helpful to understand the options offered to you and their benefits and harms.
Okay, so what we did to evaluate the added benefit of videos in addition to the questions was we compared the video alone to the 5 questions resource alone to a combined intervention in which participants received the video followed by the 5 questions. To pilot test the interventions, we conducted a randomised pilot study with 164 Australian adults recruited using online sampling. And participants were presented with a hypothetical low back pain scenario, stratified by health literacy, so we categorised people into groups of adequate and limited health literacy, and randomised into our interventions. So what did we find? In this small pilot study, we found a main effect of the intervention on self-efficacy to participate in decision-making. So for those who received the video, they had higher levels of self-efficacy to participate in shared decision-making compared to those who received the 5 questions resource alone. And we found some interesting results in terms of health literacy that we're really excited to explore further. So for intention to engage in shared decision-making, the impact of interventions differed by health literacy. So for those people with higher health literacy, the combined intervention yielded the greatest change in intention, followed by the video, whereas the 5 questions resource resulted in no meaningful change. However, for people with lower health literacy, the 5 questions resource alone demonstrated the greatest change in intention, followed by the combined intervention, with the video alone resulting in little to no change. So this was a very brief overview of the primary outcomes of our pilot study. To summarise, I guess the main points are that early results suggest that there might be an impact of different intervention types on decision-making outcomes, and a role of health literacy in determining intervention effects. And our next steps include using the pilot data to refine outcome measures and power calculations and conducting a full randomised controlled trial of the intervention efficacy in a much larger sample. And that way we'll be able to provide more conclusive results about the impact of interventions such as this. And then begin to extend beyond hypothetical online studies to explore implementation studies in clinics with patients. So there's plenty of work to do, and we're really excited to continue to work with our partners and Robin Linner and her team to explore how we can tailor and optimise interventions to better support shared decision making for all. Thanks.